Hello everyone, in this video lecture we will be discussing the case of subarachnoid hemorrhage. First we will be discussing some high yield points regarding subarachnoid hemorrhage and then we will move on to the high yield questions. So if we talk about the subarachnoid hemorrhage, it's defined as the bleeding into the subarachnoid space, which is the space between the arachnoid and the pia mater. Subarachnoid hemorrhage is mainly due to the rupture of intracranial berry aneurysm in the circle of Willis. So guys, how do we define berry aneurysm? Berry aneurysm is the balloon-like dilatation of a weak segment of the vessel, and these berry aneurysms commonly form in the circle of Willis. As you all know about circle of Willis, it's the blood supply of the brain. So the most common site of the formation of berry aneurysm in the circle of Willis is the anterior communicating artery. The berry aneurysm also forms in the posterior communicating artery and the middle cerebral artery bifurcation. Over here you can see that this is the middle cerebral artery, and this middle cerebral artery or MCA is bifurcating at this point, and you can see an aneurysm over here. This is the berry aneurysm. If this berry aneurysm ruptures, it can bleed into the subarachnoid space, leading to subarachnoid hemorrhage. Let's discuss the clinical features of the subarachnoid hemorrhage. The most important feature is that there is severe headache which is of sudden onset, and this headache is described by the patient as the worst headache of my life. This is the buzzword in the vignette of USMLE questions. Another clinical feature is the neck stiffness, which develops in 24 hours. This is due to the meningeal irritation by the blood. So guys, when the blood is in the subarachnoid space, it acts as a meningeal irritant, which causes neck stiffness. You can also find pupillary dilation and pupilledema on examination, and that is due to raised intracranial pressure. Remember that usually you don't find any focal neurological deficit like the weakness of the limbs. Usually we don't find any focal neurological deficits. How do we diagnose the subarachnoid hemorrhage? It's diagnosed using CT scan of brain without contrast. And the CT scan is positive in 90% of the cases. So what do we find in the CT scan? Normally, the areas that we see whitish over here are normally black. So what do you see in the CT scan of the subarachnoid hemorrhage? You see white or hyperdense areas due to the filling of blood in the fissures and cisterns. So guys, this is the sylvian fissure over here. These are the lateral fissures or the lateral sulci. These fill up with blood, creating a white region or hyperdense region. You can also see this white area, which is due to the blood in the basal cistern, which is the subarachnoid cistern. Right, this is the characteristic CT of subarachnoid hemorrhage. Alternatively, if the CT scan is negative and there's a clinical picture, you can go for lumbar puncture, and the lumbar puncture shows gross blood in the CSF, or there can be xanthochromia, which is the yellowish discoloration of the CSF. So the CSF turns yellow because of the breakdown products of the blood like the bilirubin. Right. Let's move on to the questions. A 60-year-old patient with a history of adult polycystic kidney disease presents to the ER with complaint of severe headache. The patient never had this severe headache in his life. So guys, this is the buzzword. This is the severe headache of the patient's life. Examination shows neck stiffness and signs of raised intracranial pressure. What is the likely diagnosis? So you all know that it is the subarachnoid hemorrhage. One thing that you need to focus is on the adult polycystic kidney disease. So guys, this is a genetic disorder which is autosomal dominant, in which you find cysts in various organs of the body like the kidneys and like the liver. So we say that there are cysts in the kidney, cysts in the liver, and cysts in the brain. And basically those are not the true cysts, these are the berry aneurysms. You can also find the berry aneurysms in a patient of Ehlers-Danlos syndrome, which is again a genetic disorder, and which type of Ehlers-Danlos syndrome has berry aneurysms? It's the vascular type. Let's move on to the next question. A 50-year-old woman comes to the ER because of sudden onset severe headache. So guys, I told you that in subarachnoid hemorrhage, the headache is sudden in onset and it's a severe headache. Her blood pressure is 160/90. There are no focal neurological deficits. So usually we don't find any focal neurological deficits like the weakness of the limbs. CT scan of her head is shown, and guys, in the CT scan, what do you see? You see white or hyperdense areas, like this is the lateral sulci. These are the lateral sulci or the Sylvian fissure. You also see the white area or the blood in the basal cistern. The patient's condition is most likely due to, what do you think? The rupture of berry or saccular aneurysm. Guys, berry aneurysm is also known as saccular aneurysm. What about the Charcot-Bouchard aneurysm? Guys, this is another type of aneurysm which is a microaneurysm. This is a very small aneurysm, and it is usually formed in the lenticulostriate arteries. Right? It is different from the berry aneurysm. We are done. Thank you so much for watching.